So hi guys, I'm Caroline. I'm a senior at Wooten High School, so this Churchill and Wooten, and this is my Girl Scout Gold Award project. So I know what you're thinking, you're a Girl Scout, aren't you supposed to sell cookies? Yes, but I'm also working towards my Gold Award, which is a really great thing to educate your community and for college. So I'll be talking about scoliosis today, and especially in middle school, because I actually had scoliosis when I was in middle school. I actually went to Cabin John between 2011 and 2015, and I have two sisters, Allison and Miranda Saenger. Allison went here last year, and Miranda is in 8th grade this year. So I was diagnosed with scoliosis when I was in 6th grade, or right before 6th grade, and I started wearing a brace throughout middle school until I found out that I needed surgery in 8th grade, and now I actually intern at the hospital where my surgery was at. So throughout my presentation, I'm going to be showing you guys some videos of interviews with a doctor who is a spine surgeon who does the kind of procedure that I had, and then 3 other girls who have scoliosis that I know, and they have, different stories to tell. So this is Hannah B, and then there's Hannah D, so don't get confused, and then there's one more, Sierra. So without further ado, what is scoliosis? Here's the first video, and I'll let that explain.
Melvin Helgeson. I'm an orthopedic spine surgeon at Walter Reed National Military Medical Center, an associate professor at the medical school, and I've been at Walter Reed since 2004. So scoliosis is an abnormal curvature of the spine. When you look at somebody's spine from the back, it should be straight. When you look at a spine from the side, it has some curve to it, but in scoliosis, the spine starts to rotate, and instead of that spine looking straight from the back, it has a curve when viewed from the back, and the curve can go to the right or left and can be in different segments of the spine, most commonly in the thoracic spine or the middle segment of the spine, and most commonly curved to the right.
So the curve would look like this. You'd see I'm kind of bending my spine, but what happens is you end up getting 3 curves. The main thoracic curve here, the thoracolumbar curve down here, and the proximal thoracic curve are the 3 curves that we always see in scoliosis, and it just depends on whether or not they are structural or if they're just a compensatory curve, that once we fix this curve, the others 2 will balance out.
So, to basically explain what he was saying, scoliosis is a condition that causes your spine to rotate and curve sideways, causing like an S shape or a C shape. And the S looks like an S, and then the C, it goes straight, curves a little, and then goes back to normal. And you can see in comparison to a normal spine that's straight from the back. It's more common in girls than boys. We don't know why. Hopefully we can figure it out sometime in the future. 80% of scoliosis cases are unknown. So we don't know why they happen. There are some reasons that they do, like genetics. You can get it from your parents, your grandparents, but a lot of the cases, we don't know why they happen. So what makes it so bad? It's bad because it can damage the joints in your spine and cause arthritis. So there are different vertebrae making up your spine, and in between each one there are discs, basically to add a little bit of cushion when you jump or walk or anything you do, and they add flexibility. But when you have scoliosis, it can put pressure on that, and it can also put pressure on the spinal cord. And so that might make it difficult to walk normally. It can also press on your lungs, causing breathing and heart problems. Obviously, it can cause discomfort and create back pain, and some people have trouble sleeping with scoliosis. Some symptoms are like uneven shoulders, uneven hips. One leg might appear longer than the other because of the uneven hips, or the body tilts to one side, or the rib cage might seem a little bit bigger on one side than the other if it bulges out a little bit. All right, here's another video.
A majority of the patients I treat with scoliosis are adolescent females who were diagnosed with scoliosis in the 11, 12, 13-year range. Sometimes they're started early on with bracing, but a majority of them end up with either nothing or bracing, and a very rare occasion end up with surgery. So a majority of the patients just get observation. Some end up with some physical therapy. If you still have growth and your curve is between 20 or 25 degrees and 45 degrees, that's the ideal window to try bracing. And the goal of bracing is really to try to halt the progression so that you can avoid surgery. Bracing is probably the most common treatment or most common active thing that we do for patients.
My name is Hannah. I'm a senior from Wooten and I'm 18 years old. I was diagnosed when I was 13, back in middle school. So I found out when I was, I think in 7th grade, because we took a physical test at gym and they made us all like touch our toes, and when I went to go touch my toes they were like, oh, that's definitely not good, because it was very tilted. So I went in to get x-rays and that's when they first saw the curvature, and ever since then I've always had back pain, and I feel like it's gotten worse even if my parents don't believe me, but I think it's just the muscle weakness in my back. So it's really not bad enough to get surgery, but I have to live with being able to sit through like an hour class and have a lot of back pain. I did try physical therapy for a little bit, but it was throughout my cross-country season and I really don't have a lot of time with that and school, so it was really hard to get in and do the exercises that I needed. I never got bracing. My grandma told me I should the entire time, and I never really listened to her. But now looking back at it, I feel like I should have gotten bracing because I kept growing afterwards, and I feel like if I had a brace, it maybe would have helped with the muscle strengthening, but now they're so weak that I can't really do anything except exercises.
Last summer, probably around June, I was admitted to the hospital because I was having upper respiratory issues and I felt like I was having a hard time breathing. And so they decided, oh, we'll just do an x-ray just to see what's going on. My lungs were fine, but they came back and were like, hey, you have scoliosis, it's over 20 degrees. But it was really shocking because I had never experienced any pain for the most part. Everything felt fine. Growing up, when I'd go to my pediatrician, they never said anything. I'd do the thing where you bend down and they check your spine. Everything was fine. I was 16. Originally, we thought that I would need bracing because when I went to the doctor, he had said that I was finished growing and that a brace wouldn't do anything at all for me. My curve is going to progress 1 degree every year, and when I was 50 or however old, I would have to get surgery. That's what he said. And at first, I had a hard time hearing that because no one wants surgery. No one wants surgery at all. He told me that a brace would actually be beneficial for someone my age and could potentially reverse my curve, not completely, but help with the pain and potentially decrease it by a couple degrees. I was actually excited to wear a brace because the first doctor told me that I didn't need one and it wouldn't help. And then when I finally found a doctor that said this may help, I was excited because I thought it was, something that may turn things around. It might be the turning point for this. I got to try it on the other day, and that changed a little bit because I realized how uncomfortable it is and how restricting it is. You don't really appreciate how you're able to freely move in everyday life until you're wearing something that restricts you so much and you feel like you're gonna fall over and you're not able to get up or sit down or anything.
My name's Hannah. I'm in 8th grade. I was diagnosed with scoliosis because I have Marfan syndrome, and it made it easier to have scoliosis. And the way we kind of figured it out was that my back was kind of like curving a little, and so we went to the doctors. I was diagnosed with scoliosis in 5th grade. I wore a brace for 3 years. So this brace is plastic. They have holes in it so you can like kind of breathe and not get as hot, because when it's a hot day and you're wearing it, it's really hot. And then it got like a lot of padding in it. It's really uncomfortable for the first days you wear it or like get a new one. So these 2 straps are how you adjust it. So you just kind of unstrap it and put it in this and then tighten it as much as you want. how you get it on is you just kind of put it around your whole body, like open it up. When I first got told that I needed a brace, I didn't really think it would be for like this long and like it wouldn't really affect me, but it did. It was hard. Like after a while, this past year, it's been hurting more. So since it's been hurting for a while, I figured out in March that I needed surgery. Even though I kind of expected it, it was still kind of like sad for me. It was a lot to like handle. It's a big deal. Surgery. It's sad. When me and my mom found out that I had to get surgery, we kind of like both started crying. It was really like scary for me. She just kind of started crying because like I was crying. Now like thinking back, it was kind of like funny, but like at the moment it was kind of sad.
So not to be a downer or anything, but those are some of the things that, you know, scoliosis patients have to go through to get treatment. Some patients have observation and physical therapy to help with the pain and to hopefully reduce the curves. And the doctors just watch for progression to make sure it doesn't get worse. So that's like Hannah B. And then the next step is bracing. So if your curve gets worse or if you just start out with more moderate curves, a contoured plastic brace is worn, and basically that prevents the curves from getting worse. And by the way, the curves are actually measured in degrees. So if you didn't understand that in the video, they're measured in degrees, kind of like in your math class when you measure angles. And anyway, so the brace helps only if you're still growing, because it can guide the body in a certain way to grow, rather than, you know, if you're not growing, there isn't any point in, you know, trying to change the way your body shape is with a brace. The next step is surgery, and that's for more moderate or severe curves. Basically, the vertebrae are fused together and there are metal rods screwed into your spine. So it's pretty scary. It'll help straighten it out. I wore a brace in middle school, like I said, and these are them right here. I went through 2. And like Hannah D said, they're hard and thick, so it gets really, really hot, especially during the summertime. So at first I was excited because, you know, it's cool patterns and, you know, something new, but then it kind of sank in once I tried it on. It was so restrictive and uncomfortable, and I didn't really fully grasp how awful it was to wear it after a couple hours. And you had to work your way up to wearing it for 22 hours a day. So that's basically, you know, all day and all night. You know, eventually I got used to it, and so my back and my core, their strength was so weak that it kind of depended on the brace to keep, you know, me sitting up straight. So it was uncomfortable to take it off, but it was also kind of uncomfortable to keep it on. And like I said, it was super hot, super, super hot. I had surgery, like I said, in 8th grade. It was me. And so surgery in general can be scary, like getting your wisdom teeth out or anything, but this was a really invasive procedure, so because it was very, very close to the spinal cord. So there are more risks like paralysis, and in addition to anesthesia complications, injury, and infection. And I was bedridden for about a week, and then it took about 6 weeks, almost 2 months, to get back to school. I was really irritable during that time because I couldn't get comfortable, but I kept up with school through the virtual tutoring from my MCPS. So it's like Google Classroom, but it has like a video chat aspect. So these are my x-rays before and then right after surgery. I don't have a more updated x-ray to show you guys, but the bottom here actually did straighten out a little bit more. Not fully, because it never will fully straighten out, but you know, it's gotten so much better after the surgery, even though it's not fused down here. So I'm here to talk about, you know, what it's like living with this in middle school, because this is a time where everybody wants to, you know, fit in. Like, you know, no one wants this kind of problem, especially during this time. So it's really important to be kind to others, and because you never understand, you'll never know, you know, the kind of things that they're dealing with if they don't talk about it. All right, so here's another video.
I had to look for prom dresses for prom, and I fell in love with this blue sparkly one, but it was backless, and I didn't realize until my mom took a picture of my back and showed me how like curved I was and how I looked from far away. And I got really insecure about the way my back looked when I didn't know people were looking at it. So I kind of panicked and I ordered a bunch of dresses that weren't backless and covered it up. And I ended up finding one, but that whole process of me panicking was really messy. And I think I got a dress like the week before prom that worked. I think people with scoliosis, sometimes you can't sit in the same place for a while. So you shouldn't be afraid to ask your teacher or whoever is with you at the moment that you need to take breaks every hour or so just to like walk around and stretch out. And you shouldn't be afraid to ask that question for yourself.
When I'm going to the beach or whatever, having fun with friends, I can feel the shift and I can kind of see it in certain pictures. And if I didn't point it out to some people, they wouldn't notice at all. But I remember last summer, after I was diagnosed, there was this one picture that I took at the beach, and I was in the water, and it was sort of a side angle, and you could just see the bump where my left rib cage comes out. And though it probably wouldn't be noticeable for most, it was noticeable for me, and I started kind of beating myself up over it. It's like, why can't it be, normal? Why can't it just be straight like it's supposed to? So I think I've received a lot of harsh criticism for myself more than anyone else. I know the main thing in high school is fit in, look normal. And that's a big shift. You go from looking normal for the most part to, things are a little different. The brace is a little bulky, especially when you're wearing tighter clothing. You may just be sitting there, in a lesson class, just trying to focus, and you look normal, but you're really hurting. Your spine's hurting, your back's hurting, and you're just trying to focus.
So when you start wearing the brace, you kind of have to gradually build up to wearing it all day or most of the day. And it took me, I think, a week to kind of get used to it. The only times that I really took my brace off in the beginning, for 2 years, was dance and gym for school. So wearing a brace, it changed my style and what I wear. Because I wore a brace, I couldn't wear all of those things where the neck goes low, because then you'd see my brace and I didn't really want people to see it. So it was hard for me to find clothes, and in the back, it kind of stuck out, so I wore a lot of sweaters to cover it up. I never really got any comments, but when I was at dance and I wore a leotard, you could see my hip kind of stick out because of the curve, and so no one really said anything, but you kind of felt they were judging you a little, but not really judging you.
Let's talk about clothes. When I got my brace, none of my clothes fit anymore, so I had to get a new wardrobe basically. And I know, it sounds great, oh my god, I get to go shopping and get all sorts of new clothes, except shopping was actually kind of horrible because nothing fit or covered the brace the way I wanted it to, and before my brace, I never would have picked this kind of clothing. I resorted to oversized t-shirts and sweatshirts and sweaters, kind of like this, and because I picked clothes for coverage, not because I like them necessarily. One thing that people don't really think about is how, clothing or costumes have to be altered when you have scoliosis, whether you have a brace or not. If you have one shoulder higher than the other, and one hip higher than the other, then, your shirt's gonna come up higher, your pant leg's gonna come up higher, so it's not gonna fit the way it's intended to fit somebody with a normal back. When I was at Cabin John, I took my brace off for PE and band, and the health room technicians, the nurses, were so nice and let me take my brace on and off whenever I needed to. The stools in your science classes, those were kind of rough to sit on. They were really uncomfortable with my brace. But also when I would sit in desks like these, my brace would lean up against it and it would make it lopsided, which was also uncomfortable. When I also sat forward, the back would stick out. See where it comes up on the back left on both of them, that would stick out, so I'd get a couple comments like, oh my gosh, is your back okay? It's sticking out. And the pain, just in general, and restriction, it was distracting from my classwork and tests or whatever. And here's another picture of a brace. When I was in middle school, I also got into volleyball. I made a club team in 8th grade, but then I had to get my surgery. So I didn't get to finish out the season the way I wanted it to, or the way I wanted to. And so after my recovery at home, I started PT, or physical therapy, and I started participating lightly in practice again. And by the end of the season, I was back on the court and playing in tournaments, which was pretty good. And over the summer, I got back in shape and I made my high school team and I made more club teams. And even though I can, get back to sports and do all sorts of things now that I didn't really feel comfortable doing before, I still can't move the way I used to with the spinal fusion, the surgery. There's like a big block of vertebrae in my back that just can't move, And one last video.
Well, back then, I didn't really understand what it would mean for like the rest of my life. I think I was more just like, oh, this is like a new interesting fact about me to tell my middle school friends, like I have scoliosis. But now it's kind of like I wish I didn't, because it's with working out and stuff and having to sit in class for long periods of time, it doesn't feel good. So a lot of my friends make fun of me because I'm just that type of person in the friendship that people make fun of, and so sometimes they use scoliosis as a reoccurring joke. And I'm not really offended by it. It's kind of just like who I am now, and I know that like I looks pretty curved from the back, and people will point it out. So I don't let it get to me at all. In one of my classes, the person sitting behind me pointed out my back in the middle of class, and they asked me like, "Are you okay?" And I was like, "Yeah, it's just scoliosis." But them just pointing it out to me kind of made me realize it's more obvious than I think, and kind of made me feel bad about, I don't know, having people to see it even like when they're just sitting behind me. More like insecure about it, I guess. I think you just have to remember that it's just who you are at this point, and there's only so much you can do with it. So you can't let the little comments get to your head, and you don't want to live your life being insecure about the way that you are. So sometimes you just have to accept that you have scoliosis, and that's just how it is, and be okay with it.
When I told my friends that I had to wear a brace, it didn't really change much. They didn't really focus on it that much, unless like I talked about it, which I didn't really do because it didn't really like affect me emotionally that much. I actually got to the point where I felt more comfortable in my brace than out of it. So it's your choice to either tell your peers or not, but like if you want to tell people, go ahead, like no one's gonna care. So I told my friends that I had to get surgery. Telling my friends was like taking something like off of my back, like I didn't have to worry about it too much, like keeping it a secret from my friends, because that's hard. So before I told my friends, I was kind of like sad about it, but after I told my friends, I was really happy because like they would be there for me like every step of the way. People who have scoliosis don't choose to have it. It just kind of happens to them. But you don't have to like make fun of them or like just kind of like bully them for something that they didn't choose.
Yeah. I'm still in the process of telling everyone that I'm going to be wearing a brace, and it may look a little different, from the outside. Don't be alarmed. I'm still working with that right now, but originally when I just brought it up in casual conversation with my friends, like, oh, by the way, and I showed them the x-ray, they kind of freaked out. They were like, whoa, that's your spine? I said, yeah, and that was a little scary because the way they reacted wasn't super supportive at first. It was more just freaked out, but as I kind of explained to them the stuff that I'm planning to do in order to fix it, they became more of a motivator for me, and they became more of a support system. Yeah. I think it's easy to underestimate what someone's going through and how they're feeling internally. You may see someone out in the streets, and it's easy to say, oh, they have a perfect life, oh, they're doing fine. But with health issues, especially scoliosis, it affects you internally in ways that you wouldn't be able to even try and explain to others. I think it's important to raise awareness and let other people know, like, it's not easy. It's not easy to go through. No one wants to go through it. No one asked for it. I think that's the most important thing.
Scoliosis is normal. It's something that happens in a lot of patients. I don't think that the average patient really has much of a social issue with scoliosis. It's only those that are in braces, and then I suppose if you undergo surgery, it's a big deal for your life, and you miss out on some stuff when you end up going through that process.
So that was the last video. All right, so when I was in middle school and I wore my back brace, I did receive a lot of rude comments, and even though they might not have been intentionally rude, they didn't mean for it to come across that way, it can still hurt. So they increased my insecurity about my brace and my back in general. And I know you guys are probably so sick and tired of hearing this, but it's really important to be kind. It's so, so important. As a senior in high school looking back, you know, middle school sucks. Everybody knows middle school can suck sometimes. It's, you know, if you are kind to one another, it's much easier to get through. Those who do receive hurtful comments, you know, don't let it get to you. You're better than that. It's not worth your time. You can totally get past that. And I know gossip is inevitable, but at least try to keep it positive. Yeah. And so here are some quotes from Scoliosmart.com. Like, people don't understand not only the pain, but the embarrassment of being crooked. Being in pain takes a toll on anyone, but when your pain is not well managed, it is physically and emotionally exhausting. So like I said, I'm here to increase your awareness. Scoliosis is a health issue and it's not a choice. It's something that you have to deal with your whole life. Even if you get the surgery, it doesn't go away. So definitely be kind to people with scoliosis or any other health-related issue, because you never know what someone's going through. All right, so I have a short quiz. It's about like 3 questions. So thank you guys for being so patient. And I have some prizes. Some fruit by the foot if you get the questions right. And they're pretty easy, so I hope you do. All right, so what is scoliosis? I saw a hand over here first. Let's go with you. Yes, it's a sideways curvature of the back. Ready? Can you catch this? Oop, oh, sorry. All right, next one. So, scoliosis is more common in, yes. It is 8 times more common in females. All right, are you ready to catch this? Nice catch. All right, one more. All right, how can scoliosis be treated?
All of the above.
All of the above, yeah. You got it. All right, if you can't catch this. There you go. All right, so that's it for the quiz. And just a little reminder, June is National Scoliosis Awareness Month, so be on the lookout, I guess, in a couple months. And also, I have this book here called Braced. It's about a girl who just started middle school, and she, you know, is diagnosed with scoliosis, and so she has to wear a back brace, you know, throughout this time. And it's really reflective of what people with scoliosis at this age really have to, you know, they have to deal with and the things they experience. So it's a good read. I would definitely look into it. We're trying to get it processed to be in the library. But you could also check it out at your local, you know, public library too. Those are my sources. And that's it. Thank you guys.
Here for like 3 years, so she was like amazing. We saw her through so much, and we're just so happy that she came back. So aren't you guys impressed? I mean, when you're a senior, maybe you guys can do something cool like this. I think our message is so great, just because we, you know, Cabin John, we have a lot of kids that have medical problems and other special needs, and so you guys are around it all the time, and hopefully you're learning, like what Carolyn was saying about how important it is to be kind. And I see all you guys doing nice things for each other. Just keep it up. But anyway, thank you guys for being a good audience.
Thank
and
you.
Thank you, Caroline. That was awesome. Very good.